Our Rotary Club in Sunrise, Florida, in Broward County in July 2026 invited Adena Wilson of the Light of the World organization to speak. Hers is a rare nonprofit organization that needs publicity far more than donations, as they have capacity to serve far more people than they are serving, although they do need donations. The Light of the World offers basic medical services for those low-income Broward residents who are uninsured, including uninsured children of working parents who are insured but can't afford health insurance for their dependents. Their services are available for Broward residents whose income is below 2.5 times the federal poverty income. Without further ado, let's hear from Adena Wilson.
So we are a nonprofit clinic. We do provide free medical care. We are located in Oakland Park. We are a 501c3. If to Broward residents who are uninsured and low income. We're going to come back to those 3 points a lot because those are our only requirements, all right? You have to live in Broward, have no health insurance, and make under 2.5 times the federal poverty level or the size of your family. So I can't give you a number because that depends on the household size. People always say, yes, okay. I know we're always looking for a catch. There is no catch. So when you or I'm assuming everybody here has health insurance, that might be a bad assumption, but we're going to go on that. When you or I don't feel well, when your child needs a physical to play football, when they fall down on the playground, you need a certain test, you think you might have COVID, whatever, you call your medical team, you make an appointment. I go in, they always have me pay the copay first. It kind of insults me, but you know. See the doctor, you talk about whatever's complaining. I actually had my semi-annual appointment Monday, and he was muttering under his breath, stupidly healthy people. And I went, oh, thank you. Get whatever prescriptions you need and you're on your way. Okay, but here's the problem. What if you don't have insurance? Now you hesitate to go to the doctor, okay? Or you don't have or you don't have a doctor and you don't have money to pay for one, all right? That's where something that we consider very routine gets to be not routine, all right? I am all for home care, self-care, okay? My doctor is a DO. I'm always saying, well, can I do that? What can I do on my own to try to lower that, raise that, whatever it is? You know, we push through, do not Google your symptoms. My daughter does this all the time. You will be convinced you're dying. Anything you Google is going to tell you you're dying. When that's not enough, what do people do? They go to the ER, right? Because they have to see me. Right? And that's true. However, here's the problem with that. Every time somebody goes to the ER, you're diverting hospital resources. You're there because you have a sore throat, or you need a COVID test, or you fell and twisted your ankle. That's not an emergency. Okay, an emergency is you're bleeding out, you just got run over by a car. So either the doctor is busy with you, or you're going to sit there for hours because the doctors are busy with somebody who's having a true emergency. This I was not aware of before I started with the clinic. The hospitals are supported by property taxes. So next time you and your neighbors are complaining about the increase in property taxes, part of it is people using the emergency room when they don't need to. Obviously it's there, you know, if we need it. But also our patients claim that they have fewer missed work days. Because if you know you have to go to the ER, you know it's going to take all day, you're going to put it off. All right, so now whatever it was is getting worse. To me, the big issue with the emergency room is that there's no follow-up care. It's a one and done. When you are discharged, they say, here you go, blah, 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 follow up with your primary care physician. But you are in the same situation you were when you got there. You don't have a primary care physician. So you're on your own. What if you have questions about the medication? What if something gets worse, gets different, something else starts? You have nobody to call with the questions. That's my biggie. People who are Light of the World clinic patients, first of all, they're not using the ER, they're not using the hospital resources, so there's no effect on property taxes. As I said, our patients say that they have fewer missed work days because the minute they start feeling bad, they say, you know what, I need to call and make an appointment. And again, my big thing is once you're approved as our patient, you have a medical home. You can call and say, hey, I'm feeling nauseous. Is that the medication? Should I take it should I be taking it with a meal? Should I be elevating my foot? What does elevating mean? Okay, one of my children didn't realize elevating means above your heart. He was like, well, how do I sit and play games? Well, no, you don't. We are your PCP on steroids, all right? Bottom line is everybody wins. There's absolutely no downside to that. We were established in 1989. Everywhere I go, people say, I didn't know about you. So please talk about us, gossip, this is good. We were founded by an immigrant who saw specifically in the immigrant community that there was a need, but it goes for anybody who falls into kind of a second donut hole. You know, they make too much for Medicaid, not enough to be able to afford the regular insurance, or they can't afford the co-pays and whatnot. And we do provide free medical care for uninsured, low-income Broward residents. All right, those are our only criteria. Wink, wink. Right? Now, let's get this out of the way. We are not a walk-in clinic, an urgent care facility, a facility where you go for a certain procedure. I need my mammogram, my kid needs a football, physical, whatever. No, that's not us, okay? And we do not provide any hospitalization services. So we are not insurance, okay? Our goal is to keep you healthy. We deal primarily with chronic issues. You know, you need your annual physical, you've got diabetes, we're going to keep an eye on that, you're having a problem with hypertension, things like that, okay? If you break your arm or your appendix bursts, you need to go to the emergency room, okay? That is a hospital issue. We are a full-service primary care physicians, again, office that again only serves low-income uninsured Broward residents. Because of this, people who want to become our patient must complete an application and be approved. So we don't want to wait. I can't tell you how many times a week I get calls. I've got somebody who's got blah, blah, blah. Can they get in to see you? Well, yeah, but they have to fill out the application first. All right, we do get audited by the state. We do have to prove that every one of our patients lives in Broward, is low income, and is uninsured. All right, that takes time. What if one family member has insurance? A lot of times when you get a job, the employer will cover the employee's insurance for free, right? But once you add that and family, it goes through the roof. It's like 4 times as much, you know? And if you only have 1 or 2 kids, that's a lot, all right? So that's fine. We can see whoever it is that doesn't have insurance. So you're going to fill out the application. You're going to say, these are all the people in the family. We have 5 people in the family, but 2 people already have insurance. So just these 3 are applying to be patients. Not a problem. All right? All ages. We have pediatrics. We have seniors. Everybody. This I like just because. And the new one just came out, so I have to change my slide. This year, 2024, my boss was very upset because this was the first year we had any good ratings. These are ratings from our patients, okay? And this was the first time we had good. Up until 2024, everything was excellent or very good. And she is bound and determined that that good is going to go away. So we'll see what 2025 said. But these are ratings from our patients, okay? It's not, I hate the word clinic, because it makes me think of those like dingy DOH places we went to in college to get our birth control pills, you know. And you should see our facility. It's absolutely gorgeous. We had someone donated money and we got all the floors redone. Everything's repainted. It's beautiful. And this is how our patients rate us. So who's a good candidate? Obviously somebody who's unemployed because they don't have health insurance. But the new thing with these part-time jobs, these gig workers, they may have 2 or 3 jobs, but none of them offer insurance. And if some of them are things like, you know, DoorDash, where the income's up, it's down, or they're doing work in the tourist industry, where there's a busy season and a not busy season, their annualized income may be below what we require. They're employed, but they have low income, or they have a large family. They're new to the area, they just lost Medicaid, just finished school, just got out of college, prison, hospital, whatever. I went through this with my kids when they finished school, college, and were too old to be on my insurance. But they don't yet have jobs. So you go to the marketplace, my daughter's was $800 a month. Well, she doesn't have a job. Yeah, so go figure. Had she been in Florida, we would have been a great option for her. Small business owners who don't provide benefits for their employees. We may be an option. Again, we're not a solution for everybody, but I've done presentations for people in the tourism industry, like the maid services that clean the resort hotels. Okay, again, during tourist season, they're very busy. On the off season, they're not. We are an option. We can at least do the maintenance. You know, they can get their medication and stay healthy. Our doctors volunteer, which means our patients get so much. I love the fact that our patients get acupuncture because my insurance doesn't even cover acupuncture. I'll give you a great place to go that's not expensive. But yes, and this is always changing. But these pretty much are always the same. Acupuncture, dermatology, gynecology, we have pediatrics, ophthalmology, cardiology, podiatry, physical therapy, a lot. We just lost our LCSW for a couple months. He's doing something, I don't know, somewhere else for 6 months. He's on some kind of whatever you call it. Hopefully he'll be back soon.
Excuse me, for us out of the health insurance, what's an LCW?
Oh, I'm sorry. Thank you. Licensed clinical social worker.
Oh, okay.
I've been on a mission for about the last 6 months to get a more robust mental health side. The problem is that whoever that organization is has to agree to see our patients either for free or for very low copay. And, and that doesn't mean $25. That's not low for our patients.
You guys don't work with NAMI?
I have been in contact with NAMI, yeah. So, one of the big things is we have a dispensing pharmacy, which means we try to give our patients the medication rather than write a prescription they can't afford to fill. During COVID, when nobody had insulin, we had insulin and our patients got it for free. We do have Saturday hours, so if it's not, an immediate concern, you don't have to pull your kids out of school or take off work. We are on the bus line, and everybody in the clinic is bilingual, all right? Whether they're doctors, staff, volunteers. We'll get to this later, but we are a teaching clinic, so we have residents and nursing students. They all have to be bilingual, which is why they throw me out in the community. But I am really good with Google Translate. If somebody showed me you can store things, I've got the whole conversation stored. I'm good. Had I known I was going to end up in South Florida, I wouldn't have taken French in high school. But I'm not fluent in that either, so. Everything's for our patients, okay? We literally exist to make sure everybody sees a doctor. Our doctors, remember, are volunteers. They're not making anything. Most of us are paid by grants. I mean, technically, I'm a 1099. I say I work for the clinic, but technically, I'm a contractor, okay? There's no annual raises. There's no corporate ladder to climb. We're here because we believe everybody should be able to see a doctor, all right? The only fees our patients pay for? Puppies. Lab work. Okay, I thought it was that's fine. It's just what the lab charges us. So, for example, a pap smear, $15. Diabetes dipstick test, $2. So, you can get a whole panel of work depending on your age and how healthy you are. For $50, $100. It's not what you and I see on our explanation of MBAs. Okay, so how do we do this? Obviously, our amazing doctors. We could not do this without them. A number of them are retired. Some of them have thriving practices. Our old acupuncturist has her own practice, but every Wednesday she would have a partner cover and she would come to the clinic. We are a teaching clinic, so we do get residents from University of Miami. We get the Nova nursing students and donations. This is how we survive. Ooh, I was at an event this morning. I have this little container where I take the pop tabs, from your Coke cans, beer cans, cat food, canned vegetables. You will save those. I will come pick them up. We do get some money for that. It's not a lot, but if I can raise $5, I can pay for 2 people's diabetes tests. Okay, if you are a statistics person, this is your tax dollars at work. The U.S. Department of Health and Human Services paid for a study where they determined that people who, because medical costs are so expensive, people put off getting medical care. And because of that, things that were little now turn into big things, and it ends up costing them a lot more money. Not sure we needed a study for that, but also children are more likely to develop serious health concerns later on in life if they don't get regular care while they're young. As a 501c3, we do rely on the generosity of our donors. They are our backbone. Foundations, grants, we used to do before COVID, which was before my time, we used to do evidently this big fundraiser that everybody still asks me about. We don't do that anymore. It was held at some church that's now no longer a church. They sold it. But I try to be out in the community wherever I can be, spreading the word and getting people to donate their time, their money, spread the word, whatever. We could not do any of this without our partners. Holy Cross does our ladies' mammograms. Walgreens does our flu shots. We do Wave Dental. We also have another dental office too now, where we have a partnership. Our patients get x-rays and cleaning for free. Anything after that, they have to, they can negotiate with the dentist. But my PCP, your PCP doesn't provide any dental, so we're trying to do what we can. We do get donations from Big Pharma, which in my opinion is a very nice thing for them to do. And we are a teaching clinic, so we do utilize the residents. You'll see on our Facebook page, my boss will post, oh, it's so sad to see them go, because she gets attached to these people. And then we get a new group. So how does someone become a patient? They do have to fill out an application, and again, they have to live in Broward, have no health insurance. That means no Medicare, no Medicaid, no M70, no kid care, and make under 2.5 times the federal poverty level. So if you Google the poverty level, for example, last year, 2025, federal poverty level for one person was just under 15,000. We're going to say 15, otherwise I can't do math. So 250% of that, or 2.5 times that, would be 40, 30, 40, 15, 30, 37.5, right? Okay. So they would have to make under 37.5. Now, the size of their family, if it's larger than one person, obviously that amount goes up. Which is why, I will mention this too, because it sometimes gets to be an issue. On the application, if you say, if the potential patient says they have children, we do need to see their birth certificates. We do not care where they were born. But because that affects the income level, because it affects the household size, if you tell me you have 8 children, you have to prove you have 8 children. Okay? That's all we care about. You can complete an application. There's QR codes on the back of my business cards. You can email me, I'll send it to you. You can download it off the website. You can fill it out online on the website. And the 2 people I've talked to, maybe because the only people that call me are people that have problems, 2 people I know that filled it out online, and the clinic never got it. So I don't, plus you have to attach something that shows where you live, how much you make, maybe your kids, a copy of your ID, so that when you come in, I can't come in and say I'm you, So I suggest that people do it manually. Complete everything, attach, I don't like to use the word documentation, complete the attachments, either mail it or drop it off at the clinic. Our eligibility specialist, Maria, will call you. She'll have you come in. Assuming everything is complete, it goes much quicker if you fill out the complete application and attach everything. You get an ID card that kind of looks like this, which for a lot of our patients is nice because it's something that attaches their face to their name. And actually, Maria's new, so let's give her 3 weeks. I mean, it doesn't take long. And again, if the application is complete, it's going to go a lot quicker. So what you can do to help us help Broward, spread the word, talk about us. Because seriously, I've been doing this for going on 4 years, and everywhere I go, people say, I've never heard of you. We've been around since 1989. Display our brochures, donate or help us locate donors. When your birthday comes around and Facebook says, hey, do you want to set up a fundraiser? I always set up a fundraiser for the clinic. I don't need the money. Collect those tabs. When I go to hockey games, I'll nudge the people next to me. Hey, can I have the tab off your beer? They go, yeah. They can think I'm crazy, I don't care. Donate no longer needed medications. A lot of people get their medications through the mail. So you're done taking it, but it still comes. Or God forbid, but I've had this happen, the person passes away. The medication keeps coming, okay? Call me, I'll come pick it up. Even as long as it's, it doesn't have to be, well, it should be in its original container, but as long as you haven't mixed it. Sometimes you go out of town and you put everything in one little, then we can't use it because then the dust has gotten into each other. Like us on Facebook, we're now on Instagram. I don't really know what I'm doing, but we have a guy that does it. Introduce me to other groups. Right now, it's a big school time. I am scheduling back to school presentations because if I can get to the families, that's who I need to talk to. Small businesses, again, that don't provide benefits. Anybody else? I would also love to connect with the discharge offices at the hospital ERs. Okay, because when they discharge the people and say, hey, follow up with your primary care physician, and if you don't have one, here's a brochure. Again, we're not for everybody, but we're something people should think about and at least know about. The more information, you were saying earlier, the more information you have, the better decision you make. Recommend any doctors who might want to volunteer. That is it. Thank you so much. I'm going to leave this up here, but I will give you brochures and cards. Does anybody have any questions?
I was going to ask where it was located.
Yes. So we're on North Dixie Highway, just north of Commercial, just south of Holy Cross, right next to the railroad tracks.
If you are in Sunrise, Florida, please visit our club. You can find the meeting times on our club website. I have a video on the history of Rotary and my personal goals in joining Rotary. What is Rotary? We have a short video that we downloaded from the Rotary International website that explains the many goals of Rotary International.